right? So there's a need for whatever reason. Um, and then all of a sudden the narrative kind of changed to like, oh, these nurses are greedy. They just want so much. And when nurses were speaking out about, you know, um, we're putting our lives at risk. We don't really know what COVID is or how to treat it. And, my nurse colleague just died, and we're not having proper PPE and masks and gowns and all that kind of stuff. And still the public perception, which is spearheaded by some different people that have their own agendas. But it was so disheartening to see that all of a sudden now it's like, oh, nurses are greedy. Why do they want more money? These travel nurses shouldn't be getting paid that much. And it also caused a split too with when you have a staff nurse that's getting paid X amount of dollars and then you have a traveling nurse. Now, mind you, they most likely do not have benefits or anything like that, which is your HR
So
stuff,
it's
right?
basically like a contractor, right?
They are a
Okay.
contractor. And so they're usually for a short term, a lot of nursing contracts are 13 weeks. And they're getting paid, but they're also leaving their family or, their house,
Going some
going
random
some
place never been before.
right. And then back to kind of that nurses eat their young and stuff. So if you're a staff nurse and you're getting paid, we'll just say 50,000, and then this travel nurse is getting paid equivalent of 100,000, yeah, you're gonna have some feelings. But instead of taking it out on this nurse that's actually here to help you, because otherwise you'd have 20 patients to yourself and now you have 10 because there's 2 of you. Don't take it out on this nurse that's literally here to help you, and maybe they are getting
I'm
paid
taking
better.
advantage of opportunity they're given.
Yep. I mean, you need to be talking to your facility, you need to be talking to your nursing leadership, and you also need to be starting to, look at legislative processes too, right? 'Cause that's the only thing that's gonna help change some of these things. But when you start taking things out on this nurse and giving them the worst assignment, treating them like crap, not giving them, breaks and all these other things that we hear about, that makes them feel like, "I never wanna come back to this hospital, I don't care."
And they're gonna tell all the travel nurse buddies, "Don't
Yep,
go to that place."
yep.
And that diversion nurse is gonna have 20, 25 patients to take care of.
And so it's this,
And
like, weird
and
vicious
so like,
cycle.
why do I have so many patients to take care of?
Yeah, yeah. And so I one of the things I is really challenging to me is like not seeing like civility between like personnel, and it boggles my mind. I can get along with just about anybody for 8, 10, 12 hours. I mean, they might work my nerves, but like I'm not going to really, and it's not that I don't like speak up or um I'm somebody that I try to give grace, and because I want to be given grace for things, because I'm not perfect and I make mistakes. But I also realize that a lot of times, especially in a hospital setting, I'm taking care of patients and their families in the worst time of their life. A lot of times, again, back to the people that are actually hospitalized, they're very sick people. They um, may not have any place to go. They may have mental health issues on top of their medical issues. And so, extending grace, and I try to treat people the way that I wanna be treated, and I also draw boundaries too. So, like, you can cuss, and like I said, I've worked with, you know, uh, a unique population for the last about 20 years. Veterans like to cuss and stuff. That doesn't bother me, but when you start cussing at me,
That's a big difference.
yeah.
That's a big
So, I'm gonna
difference.
say, "Hey, you know what? I'm not gonna cuss at you. I'm not gonna yell at you, so please don't do that to me." And I've had to say that to staff. I've had to say that to, patients a lot. And I draw those boundaries very, very, quickly, and I stand to it too. So if you start yelling at me after I've given you this warning, um, and I'm say, "Hey, you know what? I'm gonna come back because we're not gonna do that," right? And some nurses don't feel empowered to do that because of how they're trained or their cultural different things, and that can cause a lot of resentments. And so then instead of, them saying, "Hey, that's not cool to talk to me like that. Hey, don't say sexual things in front of me." They let sometimes they let these things fester, 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 and then it comes out when they start yelling at their coworker or they yell at a different patient or even that patient, and they're just like, now all of a sudden it's like the and this happens a lot to moms too, where they're like, "Okay, pick up this stuff," and nobody listens, nobody does it, and they keep reminding, and then finally mom's like, and everybody's like, "Why is mom tripping?" Right? So, same parallels. And so I think, in nursing and healthcare, we haven't really been empowered historically to like set boundaries